Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello, ladies and gentlemen. I'm Intan Rahma, and I'm looking forward to talking with you today about pros and cons dental checkup during a pandemic. Did you know that during the pandemic, many patients hesitate to visit the dentist? Have you ever had that during the pandemic, many patients hesitate to visit the dentist? This is due to concern about the risk of spreading COVID-19 virus. When I started preparing for this talk, I was reminded of maintaining healthy teeth is something that must be done every day before a pandemic, during a pandemic like now, and after a pandemic. Today, I'd like to discuss about dental checkup during a pandemic, pros and cons. This paper will discuss the middle way to check up in dental clinic, but still pay attention to the procedure will do to avoid transmission of the COVID-19 virus. Today, I will be covering these four key points. First, the risks of COVID-19 virus spread in dental clinic. Second, why it is postponed checking at dental clinic during a pandemic. Third, prevention and personal protective equipment from COVID-19. Fourth, why it is questionable go to the dental clinic. The risks of COVID-19 virus spread in dental clinic. In the saliva of patients were the main source because their salivary gland epithelial cell which might be infected with SARS-CoV. Harvey et al. 2020. Due to the characteristic of the dental arrangement, the risk of cross-infection between the patient and the dental practitioner can be high. Strict and effective infection control protocols are urgently needed for dental practice and hospital in areas potentially affected by COVID-19. From Menget al 2020. Why it is postponed checking at the dental clinic during a pandemic, having a high risk as a dental therapist for contracting COVID-19 and potentially being infected with patients attending emergency dental service should not be underestimated. David et al. 2020. Proactive and preventive action needs to be established as a mainstay program to contain the spread of the virus. Routine dental check-up in several countries, including the UK, have been suspended to reduce transmission of the coronavirus because dental and oral surgical procedures using a drill or ultrasonic instrument cause the release of aerosol. Preventive and personal protective equipment from COVID-19. While the vaccine was not yet available, personal protective equipment (PPI-1) had a lot of function in disease control. Apart from the doctor's side, there are special clothes from patients that can cover the patient's hair and clothes so that if there is residual aerosol segment that does not stick there. If the residue sticks, there is potential for new infection. Before treatment, patients are also advised to wash their hands and wash their face with antiseptic wet wipes. It is possible that the patient will need to undergo a rapid test as an early detection step before treatment. Why it is questionable? Go to the dental clinic. When a dental patient comes in well, it is recommended to take analgesia and antimicrobial ideal. However, if the patient cannot success with the approach and record action, it is imperative that the dentist have appropriate PPI and follows strict infection prevention and control guidelines. A procedure that, that can be done in a dental clinic during this pandemic. First, screen expression carefully. Second, classifying patient potentially affected by COVID-19 and third, considering covering patient as potential virus carrier for 30 days after being declared cured. Fourth, identify the patient immediately needs with minimal intervention. Five, categories dental treatment according to the urgency of the treatment needs and the risks and benefits associated with each treatment. Six, identify the dental care recruiting for each patient and the risks and benefits associated with the treatment. Seven, using personal protective equipment or PPI and R is an aerosol generating procedure appropriate for each procedure. With this policy, it is hoped that measures such as scaling or climbing out flag or taxar on set aesthetic measures shall be postponed during a pandemic. However, that extraction and filling of catheters may be carried out with due observance of health and safety protocols. Because when doing the action, the dentist is close to the patient. The patient's mouth and nose are about 15 centimeters apart from us. So the droplet can go anywhere. Therefore, a lot of silk action is restricted. Okay, a review of topic and purpose of my presentation is during the COVID-19 pandemic, people are still required to maintain dental health while at home. Among them are diligently brushing their teeth in the morning and night before going to bed, drinking water, or taking a multivitamin. Then you can add to the treatment by using dental floss and mouthwash. In an emergency, the use of telemedicine is very helpful. Among them is by doing initial screening from Beriberi and Muharram 2020. Doctors and patients can determine the right time. That's why patients don't have to wait long. The reason is, as patient must be paused for 30 minutes to find the room and check the PPI. That's all. Thank you for your attention. When any question, write in comment box in under. Wassalamualaikum warahmatullahi wabarakatuh. Bye bye.